Hi, I'm Nova May Pamaong, student number 136309234, and today I will be performing a comprehensive assessment video. And here is the video of the room 360. So, perform hand hygiene and check the room for any contact precaution. Hi, my name is Nova. I will be your nurse for today. Just to check and confirm, can you please state your full name and date of birth?
Charlie Garcia, January 31, 1987.
Perfect, thank you. As per doctor's order, I will be performing a comprehensive assessment, and I will be including assessing your general appearance, your chest, your abdomen, and your extremities. Will that be okay with you? Perfect. So provide patient privacy. How are you today, Ms. Shaira?
I'm good, thank you.
That's great. Can I please ask you to walk towards the wall, and then you may sit back again? Thank you. So the patient appears calm and coherent and cooperative with no signs of anxiety or distress, and the patient was able to walk back and forth without any difficulty or pain. And the patient's facial features is symmetrical with no signs of weakness or drooping, and then this speech is clear and articulate. So now I will be inspecting your chest expansion. Can you please take a deep breath for me? Can you please do it again? Perfect. So there are no signs of respiratory distress or use of any accessory muscles such as the sternocleidomastoid muscle, the abdominal muscle, and there is no jugular vein distension as well. So now I will be performing auscultation for the chest sound, the breath sounds. So on the interior side of the chest, I will be performing 6 points of auscultation. Can you please take a breath for me? Perfect. Can you please face the wall for me? So on the posterior side, I will be performing 8 points. Please take a deep breath. And then laterally 2 points. Please take a breath. Thank you. And I will also be palpating for the lung expansion. Cheryl, can you please take a deep breath for me? Thank you. So upon auscultation, there were no adventitious sounds heard, and the chest expansion is bilaterally equal. And now I will auscultate for the heart, apical heart sound. And to locate it, the apical heart, the apex of the heart is located in the 5th intercostal space, mid-clavicular line. It's here. I will do this for 30 seconds. Okay, so the heart rate is regular and 80 beats per minute, which is within the normal limits. So now I will be performing inspection of your abdominal area. So can you please lie down? Okay. So upon inspection, the abdomen is flat and is not distended and is symmetrical. So now I will auscultate for the bowel sounds on all 4 quadrants. Starting from the right lower quadrant to the right upper quadrant, to the left upper quadrant, and to the left lower quadrant. So upon auscultation, the vowel sounds are present in all 4 quadrants and are active. So now I will perform palpation of the abdomen, starting from the right lower quadrant to the right upper quadrant, and to the left, then to the left lower quadrant. Ms. Cheryl, do you feel any pain upon palpation?
No.
Perfect. So upon palpation, I don't feel any distension, and the abdomen is soft and there is no sign of bowel obstruction. So now I will be performing the upper and lower extremities check. So upon inspection, the patient's skin color is normal, and there are no signs of lesions, redness, swelling, especially on redness on the pressure areas. And also, I will be performing for the sensation. So, Ms. Shirel, can you feel this one?
Yes.
How about this one?
Yes.
So, the color, the warmth, and also the sensation is normal and bilaterally equal. Ms. Shirel, can you please raise your hand for me and flex it? Thank you. How about the feet? Okay. Do you feel any pain upon doing it?
No.
No, okay. So the movement is also bilaterally equal on both sides for the upper and lower extremities, and I will also check for your capillary refill. The capillary refill is under or less than 20 seconds, which is within the normal limits as well. So now I will be performing the grip. I will be performing the grip strength. Can you please squeeze my hand? Okay. So the grip strength of the arms is scored as 5+, and I will palpate your radial pulses. So can you please? So the radial pulse is located at the distal base of your wrist to the lateral aspect. Both pulses are equally strong and regular, and with a score of 2+. And for the dorsalis pedis, it is located between the first and the second digit, in the dorsal area of your feet, and an inch below it. So both pulses are equally strong and regular, and the score is +2. So for the posterior tibialis, it is located at the posterior tibia, just to the malleolus. So both pulses are also equal and strong with a score of +2. So now can you please raise your hand again, Ms. Shira? And then can you please fight back against the resistance? So for the feet, please, can you please point your toes to your nose? And then can you fight back against it? Okay. And then can you please point your toes towards me? And then can you fight against it? Thank you. So for both the resistance of the upper and lower extremities, it is bilaterally equal, and also the strength is 5+. So that concludes our comprehensive assessment. Thank you very much for your cooperation, Ms. Shira. Have a good day.